If you wanted to try a peptide like BPC 157 to heal from an injury, maybe low back pain from a herniated disc, where would you inject it? I discussed the use of peptides for musculoskeletal injuries and conditions and how you might consider using it for back injuries in this video. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. This video is yet another video in my Ask the Doctor video series based on questions you've left me in the comments to the videos on this video channel. The first question, or the only question in this video, very straightforward, comes from @ColdSun87. So if I have a herniated disc, I need to have my wife inject it into my lower spine at the location of pain. Okay, first, before I answer that question, just please know, as always, I'm not giving medical advice. This is meant for general information and educational purposes only. Also, when it comes to peptides, which are considered experimental by the FDA, I am not promoting them. I'm not telling you should use them. I am just giving information about them so that you can better talk to your doctor and see if it's a potential right treatment for you. Now, there is thought with peptides that two things. One, injection works much better than the oral form for orthopedic injuries, bone, joint, cartilage type of injuries and pain. Yes, they are equally bioavailable, but talking to a number of different people that do them, the oral form does not seem to help all that much for orthopedic type injuries. Seems to do very well for GI, intestinal, stomach, that type of thing, problems, but not as much for orthopedic. So subcutaneous injections. Now, this question, I didn't read all of it, sort of joked it needs to be into the spine. That is probably not necessarily and not possible by a particular person. There are ways to do injections into the spine under fluoroscopy by doctors and surgeons, but that's not what we're talking about here. We're talking about daily subcutaneous injections. A lot of providers that do peptides recommend just abdominal or maybe glute, but there is thought specifically with BPC that the closer you get it to the source of pain or to the source of injury, the better it works. So if it's in the knee, maybe the skin just above the knee and the thigh, something like that. Shoulder, maybe this just under the skin near the deltoid in the shoulder, that type of thing. So in this case, maybe the paraspinal muscles near that area. Again, you're not trying to get into the spine or anywhere close to that. As far as your wife doing it, yes, just because of the angle and getting to it, yes, you may need to have somebody else do it. Likewise, a question I hear a lot is if you have a knee problem or shoulder problem, do you need to get it in the joint? This is true, peptides or anything else that you're going to inject yourself, you do not try to get into the joint yourself. Intra-articular injections into the joint, whatever the substance is, need to be done sterilely and need to be done by a physician or healthcare professional, and that is not something you do yourself. So that's the thought. Subcutaneous injections, again, there haven't been great studies looking at this, but subcutaneous injections for orthopedic injuries, most people think work better than oral. And the closer you get it to the source of pain or to the injury, the better that goes. Okay, if you want a copy of my ebook, The Arthritis Solution, you can get that free. Just click the link in the description below this video. Now, if you have an orthopedic injury and you want to hear about options other than surgery and other than cortisone shots, click the link in the description under this video, fill out the contact form to schedule an appointment. I'd also love to hear your experience with your injury, back injury, herniated disc, or whatever. Leave those in the comments below. Just understand, if you leave a question in the comments, I can't offer you medical advice. But what I might do, like I did here, is potentially answer your question in a future video. Make sure to subscribe to this channel. Click the bell to be notified when I release a new video and when I start my Ask Dr. Geier live shows. Thanks for watching. I look forward to helping you feel, look, and perform better than ever.